Good afternoon and welcome to UnitedTV. My name is Kemal Erkan. Today is September 13th, 2024. Our clinical presentation, I'm going to be joining Dr. Carlo Valencia and our program manager, Caroline Weber, are going to be with me. Guys, you can turn your cameras on right now. Today we are going to talk about managing diabetes in older adults. Managing diabetes in older adults presents unique challenges due to the natural aging process and the presence of the other chronic conditions. As people age, the risk of complications are also increasing, and therefore it's requiring a very close close-up management, so that these individuals are not ending up in the critical conditions. And our goal today is to provide some guidance for those who are looking for additional support. And Dr. Valencia, who's also my primary care as well, is gonna give the presentation, and Caroline is gonna support us with the nutrition part of this. So, Dr. Valencia, if you would like to introduce yourself, please feel free.
Yeah, so again, thank you for having me. My name is Dr. Carlo Valencia. I'm one of the primary care physicians of United Medical Clinic. I've been with the practice for about 12 years now, and I'm happy to be here.
And Caroline?
I am Caroline Weber. I'm one of the dietitians on staff for United Medical, also the program manager for the Diabetes and Nutrition program.
All right, so we can go ahead and start with the PowerPoint.
All right, next slide. All right, so like Kemal mentioned earlier, so the diabetes in elderly can be challenging. It remains prevalent in the elderly populations. In fact, 25% of people over 65 in the United States and half of older adults have actually pre-diabetes. They do present similar microvascular complications like diabetic retinopathy, nephropathy, neuropathy, and they may even actually have a higher risk of macrovascular complications. So these are heart attack, CAD, peripheral artery disease, and stroke. So it's important to take care of these patients still. Next slide. And then like Kemal mentioned earlier, they can be challenging in taking care of these patients because of multiple factors, which includes polypharmacy or use of different or multiple medications that can have certain interactions and increase side effects. And you also have to consider certain things like cognitive impairment, which may range from mild cognitive dysfunction to severe dementia. And these types of conditions can definitely impact patients' self-care management in terms of their diabetes. So sometimes these types of patients may have difficulty with checking their sugar or using their insulin pens. So that's an important factor that we have to consider. Depression is also another thing that we have to consider. So sometimes patients with depression, they can overeat or they can undereat. So that can definitely impact the glycemic control of these patients. And other factors to consider: urinary incontinence, and then these patients are also at risk for falls and frailty. Next slide, please. So goals of care. So how do we take care of these patients? So I've subdivided them to 5 different sections. So mainly we try to control the hyperglycemia. Secondly, on the other end of the spectrum, we do try to avoid hypoglycemia in these patients as well. Obviously, we have to think about the other cardiovascular risk, screening for microvascular complications, and then lifestyle modifications are still important as well. So for the first section, mainly regarding the hyperglycemia, there are 3 main groups that we have to consider for these patients. The first group are the healthy adult patients. So these are patients with few chronic illnesses with intact cognitive function. So these patients, you expect them to have a longer life expectancy, like more than 10 years. We are aware that the glycemic control of less than 7.04 for most patients, but for these types of patients, we do give them a little bit of leeway. Less than 7.5% is the goal, with a fasting glucose goal of 90 to 130 and a bedtime glucose goal of 90 to 150. So second group that we have to consider, so these are patients, are complex patients. So patients with arthritis, cancer, congestive heart failure, depression, patients with like incontinence, emphysema, chronic kidney disease, and other comorbidities, or patients with like mild to moderate cognitive impairment. So these are patients with, we do have a lesser goal, like less than 8%. So these are patients that are expected to live like 5 to 10 years. And then the same thing with a fasting glucose goal, it's a little bit higher at 90 to 150, and then bedtime glucose goal of 100 to 180. And then the third group, so these are patients are very, very ill, patients with end-stage chronic illnesses. So examples of which, patients with stage 3 to 4 congestive heart failure and stage COPD, patients with metastatic cancer. So these types of patients, we were looking at like life expectancy of a couple months. And for these patients, the goal of the A1C for these patients are even higher, less than 8.5%, with the fasting glucose goal of 100 to 180, and then the bedtime glucose goal of 110 to 200. So a few things to consider with regards to medication. We do use metformin still as a first line of treatment, except for certain conditions that they may have that's contraindicated, like chronic kidney disease with GFR less than 30, or patients with unstable acute heart failure, which it can increase the risk of lactic acidosis. So we have to consider those things. We do have to think about the chronic possible effects of metformin, like vitamin B12 deficiency. So patients with complaining of neuropathy, in some cases, we do recommend checking for vitamin B12, because chronic metformin use is associated with vitamin B12 deficiency. Insulin, we do use insulin in certain cases. They can increase the risk of hypoglycemia in some of these patients, but if a patient is presenting with a very high A1C of 9, or patients with severe hyperglycemia with glucose about more than 250, then we do consider putting patients on insulin in some cases. Obviously, if the A1C remains high, we have to reassess certain things like medication adherence. We have to ask patients if they're having some side effects with certain medications, and you can ask them about nutrition. And again, like I mentioned earlier, cognitive dysfunction can affect the glycemic control of some of these patients. Depression, and then social factors. Sometimes patients may not afford certain types of medication, so that's one thing that you have to consider as well. And then if metformin is not enough, there are other medications that we do consider, but we do take into consideration patients' comorbidities, risk of hypoglycemia, side effects, and cost. Like I mentioned, insulin can be considered with patients with a very high A1C. SGLT2 inhibitors like Farxiga, Jardiance, or Ozempic, Trulicity, GLP-1 agonist. They do have benefits in patients with chronic kidney disease, and has benefits for cardiovascular disease patients. So you may want to consider these types of medications for these patients. If you're concerned about hypoglycemia, SGLT2 inhibitors, GLP-1 agonists, DPP-4, although not so much used nowadays, you definitely need to consider these types of medications. Ozempic in particular, Mounjaro. So these are the popular medications that we see in nowadays. So they do help with weight loss. So in patients with obesity, you may want to consider using these types of medications, and but you do have to consider the possible side effects because they do affect they do have certain GI side effects, so that can definitely affect certain patients, especially elderly patients. Like I mentioned earlier, hypoglycemia is also a concern. So as much as possible, we try to stay away from certain medications like glipizide or glimepiride. Glyburide in particular is a long-acting sulfonylurea, which is usually we try to avoid this type of medication as much as possible. But these are cost. They're cheaper than a lot of these medications for diabetes. So sometimes we do consider these medications still. Next slide. So second thing we have to consider for patients, elderly patients, so we have to avoid hypoglycemia as well. So hypoglycemia can lead to traumatic falls, fractures, and adverse cardiovascular events. And studies have shown that patients with recurrent hypoglycemia, especially if they end up in the hospital, has been associated with increased risk of dementia. So that's one thing we have to consider. Elderly patients may also have different manifestations of hypoglycemia. So they may not present your typical tremors, sweating. So they may present with dizziness, weakness, delirium, confusion, which can be misconstrued as some symptoms of dementia. So those are things that we have to consider. Next slide. And then you do have to consider looking for other causes of hypoglycemia, such as poor oral intake or, again, presence of cognitive impairment. I mentioned earlier that hypoglycemia can lead to dementia. Conversely, cognitive decline has been linked to increased risk of hypoglycemia as well. So it is very important to screen patients for cognitive impairment, especially 65 patients and above. Next slide. Use of medications with low risk of hypoglycemia, again, in particular, the insulin and the sulfonylureas, we try to use them with caution. Some patients, when they start getting older, it can be difficult for them to follow their treatment plan. So as much as possible, we also try to simplify their treatment regimen. So patients on multiple injections as much as possible, if you can decrease the number of injections, or better yet, if you can convert them to like oral medications, that's much better for these types of patients. CGMs, continuous glucose monitoring devices, have been popular as well. So they do help with a lot of these patients because of we can detect hypoglycemia, and then they have better hyperglycemia outcomes as well. Third thing that we have to consider for these patients, again, cardiovascular risk reduction is still a factor that we do have to consider. Smoking cessation, it's not too late to stop smoking. Hypertension, of course, although in these types of patients, the goal for these patients are a little bit lower, typically less than 140/90, unless they're really, really sick, then less than 150/90 is considered. Statin medications, especially for diabetic patients, is still pretty much recommended unless it's contraindicated. Next goal is to screen for microvascular complications. So these patients are still at risk for retinopathy. So we do recommend these patients to have their regular eye exam, to screen not only for retinopathy, but also for cataracts and glaucoma. Screening for nephropathy, so routine urine check, urine check with microalbumin, creatinine, and GFR at least yearly, and then considering referring patients to the nephrologist. And neuropathy and risk for peripheral artery disease, we do regular foot exams at least once a year, or at least every visit if possible. Slide. And then lifestyle modification is something that we do have to consider as well. So diabetes in elderly is associated with reduced muscle mass, poor muscle quality, and sarcopenia, which is loss of muscle loss, osteopenia, and frailty. Frailty is defined as the decrease in physical performance with risk of poor health outcomes. So this is associated with age-associated physiologic decline. So these types of patients, we do manage them with optimal nutrition, with adequate protein and exercise program. So regarding physical activity, we do still recommend these patients to have 2.5 hours of moderate exercise in a week. That's about 30 minutes a day, 5 days a week, a combination of aerobic and resistance training. So a moderate 5 to 7% is very much beneficial for these patients because they do help maintain physical functioning. They do reduce cardiovascular risk, decrease insulin resistance, and in some patients, they do help with depression, arthritis, and then they can also improve survival. So nutrition-wise, studies have shown that patients who are enrolled in a somewhat prescribed medical nutrition program have shown that they have significantly greater improvements in fasting glucose and A1C. Next slide. Karen will be talking about the details about nutrition, but some things we have to consider with these patients. With elderly patients, they do have altered taste sensation. They do have other comorbidities. They sometimes have dietary restrictions, compromised dentition, altered GI dysfunction, and again cognitive impairment, which can lead to erratic meal intake. They can sometimes decrease patients' ability to do food shopping and then preparation abilities. And I think that's my last slide.
All right. Thank you, Dr. Valencia. Now we are going to have the nutrition part of the presentation, and Caroline is going to give us that update.
Awesome. Thank you. So we're going to talk about diabetes-friendly meals in 30 minutes or less, 30-minute preparation time or less. Mostly because a lot of the time with aging patients, we see either decreased mobility, not being able to stand for long periods of time, needing easy recipes, finding places to save time, valuable time that you might be busy with a different schedule, but this can definitely be applied to all ages. So we want to make sure that we're maximizing nutrient content, we're balancing blood sugar, but also tapping into interesting flavors. It doesn't have to be boring. We can use certain convenience foods that we'll talk about to help make meal prepping a little bit easier. Cooking quickly doesn't mean it has to be the same meal every single night. We can find lower cost options that take minimum time, but do offer maximum nutrients to keep your blood sugar stable and keep you fuller longer. So I love this first recipe. This is quick salmon burgers. So really low cost because we're using canned salmon, which can actually be pretty flavorful if you kind of mess with the different flavorings. You can feel free to customize. If you like dill, if you like lemon, if you like parsley, you can feel free to add whatever flavorings you want here. This one has a total of 3 grams of carbohydrates. So it's really great to add a side to, right? If you wanted to add a little bit more carbohydrates, we could add a couple of new potatoes. We could add a side salad if we're going a low carb density meal. We want to make sure that we, over the next couple recipes, cover some main options, but also some side and dessert options that help give us a well-rounded meal, but also meet that, satisfaction that we have, some savory, some sweet, making sure we include different varieties of types of foods. This recipe is really great because it's quick, right? The salmon's pretty much already prepared. You mix things together, you bake it. It's a great option if you're looking to include fish in your diet on a budget and with time sensitive where you don't have to feel like you have to spend all this time seasoning it to get it just right. So quick salmon burgers, great for a weeknight meal, really quickly, easily prepared, and a great protein source as well. This is also really nice because this one can act as a side or it can act as a main option, the Moroccan couscous with chickpeas. If you want to throw in some vegetarian dishes, which I really always recommend trying out because they usually are rich in fiber and very low cost and easy to prepare. You don't have to spend a whole lot of time cooking or roasting or basting things or even marinating for that part. So we want to make sure we have some different varieties going on with protein sources and different vegetables we're including. That can also make your life a little easier. This one really increases the fiber with a lower fat density, which is really nice. But it's also something you could change around a bit. You could add different kinds of vegetables that you like. This one's pictured with carrots and peppers. If you wanted some celery, if you wanted some broccoli thrown in there, you can really customize it per your preference. My only recommendation for this recipe would be maybe add some different beans or more beans. If you double the bean of the recipe, you get more bang for your buck. So you can kind of stretch that meal. You can have leftovers. This probably would be one that would be really great flavor-wise on the next day. We also have couscous as our carbohydrate source. So this is where you can kind of pick and choose what you want your couscous or your carbohydrate to be. White couscous has a lower carb density and a lower fiber content. It also has lower calories, but those numbers don't necessarily mean a whole lot when you compare it to the whole grain option of couscous. The whole grain option is higher in calorie, a little bit higher in carb, but it's got tons of fiber. So you're getting a slower digestion of that grain. And it might keep you full a little bit longer as well. So you can kind of pick and choose what is important to you priority-wise. If you like the taste of something better, you can get fiber, elsewhere through your vegetables if you prefer the white couscous. So we want to make sure that we also are looking at the full nutrition profiles for every food, not just labeling something as good or bad, right? Each thing has an important factor about it, whether it's fiber or protein or satisfaction for that matter. So be sure to look for ways you can customize your recipes. Vegetarian options are great. They're usually lower cost and quicker to prepare. This chicken stir fry with veggies is a great one, especially if you're looking to lower the carb density total. If you're having trouble and you're really fickle with your blood sugars and you really just can't afford to have any carbohydrate in that mealtime, this one's a great one, especially if you have leftover things you need to use. You could throw in any vegetable that you prefer, and you can really change around the protein option. Do beef, you could do beans, you could do tofu, you could do chicken, whatever your preferences is, you could change around this recipe. But vice versa, if you wanted something a little bit more filling, or you're feeding a large group of people, or you just want something to last a little bit longer so you can eat some leftovers, try adding fiber-filled grains to it. A complex carb like quinoa or whole grain rice or farro would go really well with this. That would help you stretch it. It would also keep you fuller longer, but it's perfectly okay if you're kind of just using a lower carb density and focusing on those high fiber veggies and protein options. A lot of the time, patients kind of get burnt out on trying to find meals that work for them and their families, finding something quick and good and not the same thing every night. So we want to include a variety of flavors. And I think these turkey burritos are really a great way to do that because you can expand, flavors to spicy or savory. And you can pack a lot of punch in a small amount. So you could flavor the beans or you could flavor the protein and have that kind of spill over to whatever you're mixing it with, whether that be vegetables or rice or anything like that. You could also alter this into a salad, right? If you don't want the carbohydrate, or maybe you're not a big fan of burritos, you could throw it on top of a salad for a lower carb dense, maybe throw in extra beans for a little bit of more fiber, for starchiness. But you could also kind of use this as leftovers. This is a great thing to have leftover filling that you would end up using later on in the week. So the goal is one pot meals if we can. Keep it fast, keep it easy preparation. You can even use, convenience foods like frozen and canned vegetables here. They're equally nutritious. Obviously with canned, we want to make sure we rinse that off if we're watching our sodium, but you can get just as much fiber, just as much vitamin and minerals from those canned and frozen options. And they might be a little more cost effective as well, especially if you don't end up using all of that produce in the fridge, if it's more likely to go bad, or if you're just not in that place to spend time cutting and chopping things, right? Having beans and already chopped up tomatoes and corn, having that already there and present and prepped for you is really helpful if you're trying to limit time. This one is great, especially for some new flavors as well. So a warm Asian beef salad, where it offers you some different flavor profiles, but also a really great way to customize what you want in a salad, right? You could change the vegetables, you could use those canned, frozen, fresh vegetables if you want to. If you're not a beef fan, you could change it to chicken, or you could even, use some type of bean or lentil if you're going the vegetarian route. We also don't want to encourage skipping on the dressing either, because the dressing plays a really important role. It offers a fat source. Fat sources help to slow down the digestion just as fiber or protein would to give you a better balance of your blood sugar, but it's also going to increase the absorption of your vitamins and minerals found in those fat-soluble vitamins in those vegetables. So having a good source of fat, a good source of protein, a good source of fiber, and stacking that on top of your carbohydrate is really going to give you the best benefit. Something I would love to add to the salad, maybe be some like mandarin oranges or something like that to give you a little bit of sweetness, a little bit of carbohydrate in there, but still a good fiber source to support your meal overall. And here's like a nice side that I think is great to include, especially we're out of summer almost, but having some squash or zucchini or any vegetable really and roasting that. You can also find a great deal on like frozen cauliflower or frozen broccoli where you could do the exact same thing you're doing with the zucchini or squash and not have to cut it up. So you could just dump an entire bag full of frozen cauliflower, cover it with a little bit of olive oil and your seasonings, and that could be a great supportive side for whatever you're having for your meal. So it's a limited lower density carbohydrate, but you could stack a protein on top of it. And it's just a great addition to have to increase vegetable consumption, but also to balance your blood sugars. And I'm a dessert person, so I always love to throw a dessert anywhere I can. And it is possible to enjoy, sweet things, but also manage your blood sugar. There's just a way that we do it well. And that's making sure, one, we have a great supportive meal, right? We've got protein, we've got fiber, we've got some fat in there to slow down digestion. But we also want to take into account the portion size of our dessert, right? And the frequency of how much we have. So allowing that spreading out of the carbohydrate intake is very helpful. But there are options for elevating the protein in a dessert, right? So this blueberry chantilly is great because you've got high fiber fruit. Usually the fruit is a lower sugar density. So you've got those berries that usually are on the lower side of the sugar compared to other fruits. And you've got some cream cheese. You could even play around a little bit with higher protein dairy like ricotta or even Greek yogurt. There's a great Greek yogurt cheesecake dip out there with sugar-free cheesecake jello mixed with Greek yogurt and whipped cream. Fantastic. So there are workarounds for dessert if you want to balance the blood sugar and have a little bit of a larger portion size on occasion. But more so, we just try to keep the portion size small. Obviously, allowing yourself permission to eat dessert when the time comes, like if you're with family or it's a celebration or when you really just want to enjoy something sweet, giving yourself permission allows us not to have that restrictive nature with sugar where that tends to have us overeat, right? So allowing us to have regular, frequent intake if we want in small portions, but also making sure that we're balancing our other meals because that matters just as much as if we're including a dessert and trying to balance our blood sugar through that as well. So with that, we want to kind of touch on how do I build, a meal to balance my blood sugar? Basically, all of these meals had a common theme: protein, carb, fat, and some fiber thrown into there because when you stack them on top of each other and create a well-balanced meal, your blood sugar is very happy because we're slowing the digestion and breakdown of that carbohydrate, which means a slower rise in blood sugar. We also want to make sure, our goal is to add some different varieties, right? Fruits, vegetables, lean proteins. The nutrient content matters. So we're supporting your nutrition status with all of those things, which is especially important as we age, right? We can easily be deficient in things, not eat as frequently, have different hunger cues. So we want to make sure we have really good nutrient-dense foods because the more density we have, usually better blood sugar control because we're kind of pairing things together. We want to make sure you're also staying fuller for longer because that means we're less snacky, less, a little smaller portion sizes throughout the day, which supports good blood sugar as well. So I like to break it down into really easy steps of find your protein, choose your veggie, Ask yourself, what carb do I want if I want any? And can you add more fiber? We're always looking to see what can we add to a meal rather than what can we take away. And just a summary that all foods fit. We get a lot of patients coming in really scared to have certain foods or just saying, I can't have that, it's not good for me, right? All foods have a purpose. And of course, there are certain ways to eat those simple high sugar carbohydrates that we want to do that carefully if we're focusing on blood sugar management. But especially as we age, right, we want good quality of life. And for those especially who have cognitive decline, we really liberalize the diet and to focus on what can we add to the diet to support overall health and quality of life during that time too. There are specific and convenient meals to make on short time, and especially if you can't spend that amount of time cooking or prepping in the kitchen. We just look for those modifications. So don't be afraid to rely on some convenience things like buying frozen and canned, pre-cooking, dinner meat or prepping ahead. And even simplifying the foods to snack plates, right? Adult lunchable type things where you could have cheese and crackers and maybe a fruit. Those can still count as a really great balanced meal. We just make sure we have our components of our protein, some fiber, some complex carb. We want to find the key nutrients to balance your plate, but also your blood sugar as well. That is it.
All right. So we can stop sharing.
There we go.
All right. Well, thank you for both for the presentation. So, well, this is an important issue, especially when I look at it from the support standpoint with those individuals who are managing these different and multiple chronic conditions together. One is I want them to know from United Medical ACO standpoint, we have resources available. We have social workers as part of the team, other than our 5 dietitians on board. I hear every once in a while when we do the case conferences, patients, in some cases, they don't have enough money for their co-pays and they're delaying to refill the medications. We want to make sure that they are able to reach out to us and communicate with us. So there are usually solutions and we can definitely help them in different ways. And I want our patients to know that hopefully they can find some useful information from our presentation, because every time they have questions or every time I talk to someone who have different types of issues that they have to take 4 or 5 different medications, it's a challenge. So, and then there's usually those gaps in between, or not being able to get their labs done, not having proper access to food. So these are all important issues, and we are here for our patients. If they can please communicate with us openly, so then we can put right resources on their direction. So anything you guys would like to add?
On my end.
Well,
No, I'm good.
we forgot something really important. So, and no one was asking where Donna is.
Oh, where is she?
So she's celebrating her birthday. So,
Oh, happy birthday, Donna.
happy birthday, Donna, if you are watching this, although she took 2 days off to celebrate, so I'm sure she's not watching it, but happy birthday, Donna. So we'll see you next week. Thank you for joining me, and we'll be back.
Thank you.
Bye-bye.